Good evening, everyone. I think we may still have more folks joining, but because we don't want to take up one of the last lovely evenings left in the fall in the prairies, I think we will get going. So my name is Marianne Pladoon, and I'm the Regional Executive Vice President for the Public Service Alliance of Canada Prairie Region. And as is our usual practice, I will begin with the land acknowledgement. So tonight, while we have members gathered from all three provinces, I would like to acknowledge that I'm currently joining you from Treaty 1 territory. It's the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and the homeland of the Métis Nation. We also acknowledge that within the Prairie region, we gather together from Treaty 4, Treaty 6, and Treaty 7 lands and the homeland of the Métis Nation. We are dedicated to ensuring that the spirit of reconciliation in all treaties are honored and respected. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. So, my friends, the pandemic has been exceptional for all of us. It has exacerbated inequalities in our social safety net. It has demonstrated that in order for us to not only move past the pandemic, but recover from it, we need to work together. Working together, collective action, and empathy for your fellow person are all very familiar for the labor movement. The impacts to ourselves, our families, and communities will be felt for many years to come. That is part of the reason we assembled this panel of experts to discuss the issues that matter to you in this federal election. This federal election is different, not only because it's being held during the pandemic, but because whichever party or candidates win the election, they will need to act for Canadians on day one. And because of that, folks will need to know what policy decisions need to be made to ensure that public services and goods we all rely on will be strengthened moving forward and not just cut or privatized. So tonight, we are joined by some special guests. We're joined by Larry Russo with the Canadian Labour Congress, Sandra Azikar, Executive Director of Friends of Medicare and a board member of the Canadian Health Coalition, and Hadrian Mertens Kirkwood with the Canadian Centre for Policy Alternatives. So just a few housekeeping items. You will all have an opportunity to submit questions to the panelists tonight. Please note, we'll try to get in as many questions as possible. And if we're unable to get to your question, we will look at the questions after and direct them to the appropriate person for a response. So without any further delay, let me introduce our first speaker, Larry Russo. Larry is a former PSAC member. No, he's still a PSAC member now that I think of that.
Absolutely.
He was the PSAC Regional Executive Vice President for the National Capital Region. He was recently reelected as the Canadian Labour Congress Executive Vice President. He has a certificate in civil law from the University of Ottawa, Faculty of Law, Civil Law section, and a master's degree in public administration from the École Nationale d'Administration Publique in Quebec. I hope I did that okay, Larry. Yeah. Larry has a long history of trade union and political activism, particularly on issues like labor relations, health and safety, human rights, and equity. And his involvement in the LGBTQ2SI, anti-racism, and peace movements have been an integral part of his engagement and commitment to social justice. So, Larry, my friend, it's been a while since we've been around the table. Thank you, and we'll turn the floor over to you.
Thank you so much, Marianne, and it's wonderful to be back in at home at PSAC. And greetings, friends and allies. My pronouns are he and him, and it is my absolute privilege to speak to you today from the unceded, unsurrendered territory of the Anishinaabe, whose presence here reaches back to time immemorial. And I'm grateful to live and work on their ancestral lands. And it is my absolute pleasure to bring you greetings on behalf of the Canadian Labour Congress, and especially our new President, B. Brusk, our Secretary Treasurer, Lily Chang, and Executive Vice President, Siobhan Vipan. I'd like to thank PSAC Prairies Region, Marianne Ledoux, and the executive for inviting me to take part in this important discussion to talk about jobs, workers' rights, and the importance of this upcoming federal election. My friends, we are in unprecedented times, and we're still in the thick of a pandemic that is not letting up. The Prairies region is being hit really hard by the fourth wave, with Alberta and Saskatchewan having the highest rates of COVID-19 in the country. And agriculture has suffered severely due to extreme heat and drought this summer. Add fires to that, and then with all these events impacting workers, their families, communities, we find ourselves in the middle of a federal election. Workers and their families have faced unrelenting challenges these past 18 months. And the one thing that comes to mind is that we need to all thank public service workers everywhere for stepping up to the plate during this seemingly endless pandemic. Your dedication and your hard work have kept us all afloat. During these challenging times, there is also opportunity. And you know that the pandemic has exposed many issues, many weaknesses in our society. And bearing the brunt of this pandemic are women, young workers, Indigenous people, Black, Asian, and other racialized people, newcomers, as well as low-wage, gig, and contract workers. So the pandemic has shown a light on how we value different work and how we value different workers. Last Friday, the latest job numbers came out, and although we are very slowly making progress, the job market remains far from recovery. Last month, compared to pre-pandemic levels, almost 250,000 more people with jobs worked less than half their usual hours, and long-term unemployment is a reality for 215,000 Canadians who have been without work for the past 6 months. But reaching pre-pandemic employment levels is not enough. We have to do better. We have to do better and move forward to full employment so that every worker who wants a job can find one. My friends, the outcome of this federal election will have a huge impact on all of us. And you know as well as I do that the government that we elect will be shaping the future of this country. So we cannot get this wrong, but there are looming threats. Erin O'Toole is no different than Stephen Harper and Andrew Scheer. The Conservatives will always back business and the rich, and don't be fooled by the kinder, gentler conservative leader. They are no friends to working families. Erin O'Toole's Conservatives are going to cut off critical emergency pandemic supports to workers. They're going to cancel affordable childcare and increase privatization. You can take that to the bank. Let's be clear. As the Prairies grapple with the fourth wave, this pandemic under a Conservative government has been and will continue to be devastating for workers. Let's just look at Alberta. Jason Kenney thanked nurses for their months of exhausting and dangerous work by proposing a 3% rollback in their salaries. Thank you very much. We cannot allow the Conservatives to lead the recovery because it was decades of Conservative cuts to services that put so many people so close to the edge before this pandemic hit. I called the Harper years the lost decade. Years of attacks on workers. Conservative premiers, the provincial premiers, could have ensured that workers would have had access to paid sick leave. They could have invested in protective equipment in long-term care and in the long-term care homes. They could have made investments to help slow the spread of COVID-19, and yet they hesitated, they hummed, they hawed, they balked. Conservatives can't be trusted to put workers first. They always put business and the large corporations first. My friends, workers must be the priority. There can be no recovery without workers. So there'll be no recovery without investments in workers and their families. And we need to elect a government that will make those investments. I don't want to hear more stories of Canadians who have to choose between their medications and their heating bills. We all know someone who was a child with chronic asthma or a medical condition, and they're trying to balance their monthly grocery bills while their children gasp for air. You know, they spend their time, families today, trying to figure out how they're going to manage the family budget and what they're going to have to cut. We all know a mom out there who can't work because she can't find affordable child care. We need a government that will keep its promises and a government that's going to deliver the programs that will help lift people up. The struggle is far from over. Inequality has been growing for decades. Hate as well is on the rise. This is all interconnected, folks. This election is our opportunity to create change, to demand clear, concrete commitments of all of our candidates. Let's define Canada's priorities in this federal election. This is our opportunity to fight for decent wages, working standards, and equity so that we can make sure that no one is left behind. In this election, the labor movement right across this country is demanding that Canada replace the jobs we lost in the pandemic with better ones. We also know that workers' rights are human rights, and it's our opportunity to fight for paid sick leave and social programs like universal single-payer pharmacare, affordable child care, not child tax credits, Mr. O'Toole, better health care, and a stronger social safety net. You have done the work to put these issues front and center in this election. The only reason we're talking about these things is because of the years of advocacy and militancy that you have done. You're fighting to put an end to precarity and insecurity, and you can demand bold climate action and a sustainable recovery. This is our opportunity to protect the planet for future generations. We'll work together to do what's best for our families and our communities, and we're so much stronger when we work together. Workers and their families have pulled this through this pandemic, and they must be prioritized in this election. While many workers find themselves falling further behind, billionaires are enjoying larger profits than ever. There's money out there, folks. Don't be fooled. While workers turn their minds to their kids' classrooms and struggle to balance childcare and jobs, billionaires turn their eyes to the stars and Mars. This pandemic has exposed the great disparities between the super rich and everyone else. And so as we recover from COVID-19, let's ensure that we don't return to the pre-pandemic status quo. It's time for the ultra rich and the pandemic profiteers to pay their fair share. That's all we ask. Recovery from the pandemic means taking real steps to address inequality and real steps towards reconciliation. The federal government has to raise taxes on wealthy individuals and big businesses that make record profits. Did you see the bank profits in the last quarter? Absolutely mind-boggling. The revenue from these taxes will help rebuild our social safety net. We've had enough of consultations. We've stretched out the timelines. We don't want any more broken promises. It's time for national universal pharmacare. It's time for national accessible universal childcare. And it's time for every job to be a decent job. And that means a permanent job that pays living wages, has good benefits, and comes with a pension. A permanent job supported by a union. Friends, there's so much at stake here. Workers have the opportunity to turn this election into a national referendum on a pandemic recovery that leaves no one behind. We're just 1 week away from Election Day. We ask each one of you to make this election count. Press your local candidates and national parties to support worker issues. Let's put workers and their families at the heart of this election. And most of all, get out there and vote. Get your family members to vote. Get your friends to vote. Everyone, vote. Thank you so much again for having me. I look forward to the discussion. Merci and miigwech.
Perfect. Thank you so much, Larry. I just always love hearing you speak.
Thank you.
Yes. And you're always available to us. So thank you very much for your presentation. I will just make a note that if you do have a question for any of the panelists, You can put your question into the question box that you should see on your screen. And so you can type it in there, and you can do so at any time. So you don't have to wait until we're done. And so, sorry. So our next topic is the discussion of healthcare and pharmacare, which Larry already spoke a little bit about. And to discuss this further, we have our guest is Sandra Azikar. I'm sorry, the stupid cat. Okay. Sandra Azikar is the Executive Director of Friends of Medicare and a board member of the Canadian Health Coalition. She's been an advocate for a fair and equal society for more than 30 years in Alberta. Her past experience includes working as a child protection worker and volunteer work within the Chilean community as well as the labor movement. She has served in many positions in the Alberta Union of Provincial Employees, AUPE, including Vice President from 2007 to 2012. And Sandra's also served on the board of directors of Friends of Medicare for 6 years prior to becoming the executive director in 2012. So Sandra, thank you. Welcome to PSAC Prairies, and we'll turn the floor over to you.
Thank you so much for that introduction. Just to let you guys know, I started my advocacy when I was 12. Anyways, I just would like to acknowledge that I'm joining you from Treaty 6 territory, the land of many First Nations, the Métis and Inuit, whose footsteps have made these or have marked these lands for centuries. So thank you to PSAC Prairies for allowing us to share a few words. Friends of Medicare is an advocacy organization that has for the past 42 years been promoting the protection and expansion of our public health care, not only in Alberta, but across Canada with the work that we do alongside the Canadian Health Coalition and the provincial and territorial health coalitions. We're a nonpartisan organization, but we are political, as we believe that without being able to understand the role of the political ideology, the values and beliefs of those that are at the leadership positions, we cannot truly impact change or partake in the important at the table discussions that need to be had so that as a society, we don't leave anyone behind. When we speak about jobs and a just recovery, we would argue that healthcare must take a front seat in all these discussions, as without a healthy population and workers, we can't move our country forward. And as we continue to navigate COVID-19 pandemic and all its variants, we have seen the importance of universal healthcare as a public good for all, regardless of the income, age, immigration status, or where we live in this vast country of ours. Unfortunately, what we also saw is that our public healthcare system does not meet everyone's needs. Tonight, I'm going to speak from a place of values. Our healthcare system was established on the value of equity, from the basic belief that if we can't be equal when we're sick, then when can we be equal? From a place where, as Tommy Douglas said, that no Canadian will ever have to die or go bankrupt because they can't afford healthcare. For this purpose, we need all levels of governments to be committed to improving and defending the public healthcare system that we all rely on. Not always the case, unfortunately. Being 6 days from voting day, I'm sure that you must have heard a number of takes around where parties stand on healthcare. And my presentation will focus on a few areas of advocacy and concerns that we see across the country. So just to briefly set the stage, our Medicare system refers to Canada's publicly funded healthcare system. Instead of having a single national plan, we have 13 provincial and territorial health care insurance plans. And under this system, all Canadian residents have reasonable access to medically necessary hospitals and physician services without paying out of pocket, even though that medically necessary varies widely from province to province. Fortunately or unfortunately, our healthcare system is sometimes vulnerable, as we have seen with COVID. Its limits have exposed, and significantly so in some provinces, due to decisions made or not made by provinces to reduce spread or to deal with this COVID pandemic. Each province is unique in the fact that they are led by different political parties who, as I mentioned before, come with a worldview. I always find it quite amusing when politicians accuse each other of making ideological decisions. I guess ideology is only a problem when you don't agree with it. And healthcare is so much more important than that to each one of us, to our families, to our communities, which is why it's in the best interest in all of our best interest to become aware of that whatever it is that those are seeking to lead us are actually talking about and sifting through the narrative that's coming from all political parties. Anyways, going back to the governance of our healthcare system, the federal government is responsible for setting and administering national standards for the healthcare system through the Canada Health Act and to provide funding supports for provincial and territorial health services. For all intent and purpose, the Canada Health Act sets the national policy, and execution and delivery is the provincial jurisdiction. The Canada Health Act lays out the 5 principles: universality, portability, accessibility, comprehensiveness, and public administration that must be followed and respected. And it's ultimately the only way that the federal government has in terms of financial consequences when provinces are found to be in violation of the act. So it's the only way that they can enforce any kind of violations. So when it comes to funding, Canada's universal healthcare system requires federal vision and federal leadership. In 2014, we saw the expiry of the Canadian Health Accord that was set up as a way of uniting the country and recommitting to the shared vision and encourage the scaling of best practice and implemented national standards, no matter where Canadians lived, that they could all access high quality public. That went out the window. And since this time, the declining share of federal funding for healthcare included in the bilateral agreements that were signed instead of recommitting to national or federal leadership in healthcare have only exacerbated the problems of and have increased the fiscal pressures on provinces that will therefore face significant increase of pressures when providing healthcare services to their provinces. But it also has reduced the authority of the federal government in upholding national standards to protect Canadians from user fees and extra billing. Bilateral agreements threaten the portability of Medicare, leaving patchwork systems where some services are public in some provinces or territories, but not in others. So in order to safeguard public health care for all, the federal government must agree to pay their fair share, and that is reflecting of their commitment to meeting the real cost of healthcare. This requires at least a 5.2 Canada healthcare transfer escalator or more. To strengthen public health care, we need a recommitment to the Canada Health Act, and strings must be tied to the Canada Health Transfer so that every single dollar for public health care is actually spent on public health care. And we need to see national standards that need to be implemented so people across Canada can access the same high quality public health care services with reduced wait times. So privatization is another area that we have actually seen, and we firmly believe that public healthcare system that is well funded and publicly administered provides the fairest, highest quality, and most cost-effective care. Private for-profit investors should not be allowed to undermine our public healthcare system. There should be no place for profit in healthcare, whether through private clinics, paid blood plasma collections, corporate delivered virtual healthcare, or long-term care facilities, full stop. We need to understand that for-profit company exists solely for profit. Stakeholders demand maximization of profits and growth of margin, and this takes priority over patients. We also have the issue of accountability, where the majority of these commercial contracts that are actually being given out in the hope to improve our healthcare lack accountability. We have no way of showing how many procedures are botched and how much that costs the public system to fix. We cannot see how patients are harmed by private healthcare providers. This so-called commercial confidentiality serves to cover up cost escalations, margin growth, quality performance standards, and contract failures of private companies. So there's all kinds of solutions to the problems in our healthcare system. And fortunately, when you look at some of the platforms, the conservatives who stand out, politicians see the privatization even more as a way of solving our problems. They will convince millions of us to agree because Canadians cannot get access to the facts and data because of the built-in protection of private companies. So we fully expect that all the premiums for Manitoba, Alberta, and Saskatchewan to be fully aligned with the O'Toole campaign on healthcare, where they claim the only solution to the issues facing healthcare is to bring in the private sector. And I know that Larry addressed a little bit about pharmacare, but I think it's important to know that despite the long history of calls for national pharmacare in Canada, beginning with the introduction of our universal healthcare system, we still don't have it. Pharmacare has been called the unfinished business of Medicare, leaving Canada as the only country that has a public healthcare system which does not cover prescription drugs. The universality of our healthcare system ends when we are given a prescription, and that cannot be the case. Studies have shown that we will save money. Most importantly, we will save lives of Canadians. Every single study, every single parliamentary budget officer report has indicated that this is something that governments need to do. There has never been the political will to actually do this, and in this election, we must demand that everybody just doesn't promise it, that they would actually have an implementation plan in mind, because if this is not the time to actually implement this, I don't know when it will be. We saw through COVID, people lose their jobs, hence they lost their benefits. And we continue to see, as Larry said, families having to make decisions between paying their heat, their rent, their food, and their much needed life-saving medications. And I think that that's about my 10 minutes. I left something out that's really important in terms of seniors care, but I'm hoping that we can have a discussion through the questions that hopefully we'll be receiving. So thank you so much.
Thank you so much, Sandra, for your presentation. I mean, healthcare is top of mind for all of us right now. So I would like to welcome our next presenter, and he will be talking about just recovery and transition. So I'm happy to introduce Hadrian Mertens-Kirkwood with the Canadian Centre for Policy Alternatives. Hadrian is a senior researcher with the Canadian Centre for Policy Alternatives. That is a charitable, nonpartisan public policy think tank. I don't know why that's hard to get out those words. His work focuses on the social and economic dimensions of Canada's shift to a zero carbon economy, including the necessity of a just transition for vulnerable workers and communities across the country. He is a contributor to the CCPA's Trade and Investment Research Project and the Alternative Federal Budget, and he holds a master's degree in political economy from Carleton University. So thank you and welcome to the Prairies, Hadrian.
Yeah, thank you very much. I am, like Larry, joining from unceded Algonquin and Anishinaabe territory, and I'm very pleased to be with all of you. I have to say, Larry and Sandra did a great job of laying out a lot of the necessity of a just recovery and a lot of the issues that are at stake. So hopefully I can be quick and we can get into questions. But I do want to talk about this, the next big piece. We talked about workers, we talked about healthcare, and the last big piece is the environment. And this is something that we really need to be thinking about in the context of a just recovery and a just transition. As a quick kind of definition point, just recovery has kind of emerged in the context of the COVID-19 pandemic. How do we bounce back from this pandemic towards an economy and a society that is more equal, is better than the old status quo, a more just society, ultimately. That's the imperative here. A just transition is a term you may have heard, and that refers to the same sorts of things, same prioritizing equity and justice, but in the context of our energy transition. As we move away from fossil fuels towards a cleaner economy, how do we make sure people aren't left behind? And in fact, how do we do one better and make sure that workers and communities are even better off as we make that transition? And I just want to emphasize again, and we've already heard a bit about this, about why our old normal is not something we want to return to. And we've heard it again and again during the pandemic that we just want to get back to normal, and we all feel that. But I think there's a growing recognition that the old normal was not serving everyone equally well. And in fact, in a lot of respects, we can never go back to that old normal. So we really need to be thinking about what is the better economy, what is the more just society we want to arrive at as we emerge from the pandemic, which is not yet concluded, but also as we make these broader shifts in the global economy towards a zero carbon economy. So that's a lot of what's at stake here. I shouldn't have to remind you that the impacts of climate change are increasingly evident. It's been really in our faces in the past few months, unfortunately. We've seen the impact of wildfires and heat waves. There have been an unfortunate number of deaths related to heat waves. We've seen towns literally burned to the ground because of uncontrolled wildfires. And the unfortunate reality is we're going to look back on this summer as one of the good ones in 5, 10, and 20 years. That doesn't mean we give up hope. It means we work extra hard to fight climate change. But I also want to emphasize that as we talk about this issue of transition and what it looks like, this is not just an environmental issue. That alone should motivate us, but this is an economic issue too. I think there's a bit of a myth that we hear in Canada that no one in the world cares about climate change. It's just our politicians that are trying to drive our industries into the ground. And that's what's at stake here. But the reality is that this transition away from fossil fuels is happening already globally. And in fact, we are well behind the curve. Since 1990, Canada's emissions are up 20%. That's almost entirely due to oil and gas extraction. In the same time, the UK's emissions are down 40%. Germany's emissions are down 30%. Even the US's emissions are flat since 1990. So we are one of the worst developed countries in the world when it comes to emissions. And we are way behind on some of the shifts that these other economies are making. Investors are moving out of oil all over the world. Their renewables are increasingly cost competitive. So, forget our regulatory phase out of coal power. We wouldn't be using coal power in 10 years anyway, because it's more expensive, worse for health than renewable options, regardless of what our governments chose to do. The biggest economies and our biggest trading partners are shifting to zero emission vehicles, electric vehicles, both on the production side and in terms of getting more on the road. And then there's even economies like the EU, Europe is putting in place a border carbon adjustment, which is essentially a carbon price on imports. So even if we had no carbon pricing in Canada, we would be paying a carbon price in our exports to Europe. And the US is talking about doing the same thing. There are lots more examples of this. Denmark and New Zealand, for example, are two countries that have said we are just not producing any more oil. They've started to shut down their domestic industries. Scotland is another example. Germany's done the same with coal. So this is happening all over the world, whether we like it or not. Whether we like it or not, putting aside these very obvious impacts of climate change and how we know that the oil we produce, the oil that we consume is contributing to climate change, putting aside all that, our fossil fuel industry still is not going to survive in a global economy where everyone else is moving away from fossil fuels. So the choice we have in Canada is not between soldiering on and ignoring all that, because we can't. We have an export-oriented fossil fuel industry. And then the alternative being this disruptive, unnecessary transition. That's not the choice we have. The choice is between an unmanaged transition, like so many previous resource busts in this country. We have a very terrible record of not supporting workers, not supporting communities as resource industries struggled. And there's examples from coast to coast to coast to illustrate that. The alternative is a managed transition, one where we are honest with ourselves, with each other, about what our industries are going to look like in 10, 20, and 30 years. And then we actively work to develop plans with workers, with communities, to make sure that no one is left behind as we move to cleaner alternatives. That's the real choice here. And it hasn't been framed as such in this election. But again, we can either stay on the sinking ship, which is being attached to fossil fuel production and consumption, or we can start looking for lifeboats and pursuing a managed transition to a different economy. That's the choice that's at stake here. Now, the Canadian Center for Policy Alternatives, we're a nonpartisan think tank. We can't take partisan positions, but I think it's fair to say that not all the parties on offer in this election are taking this twin crisis of climate change and inequality equally seriously. And rather than endorsing a party or a platform or a candidate, I think there are 4 questions that we ought to be asking of our candidates, of our parties. And the first of these questions is, who's being honest about the future of the oil and gas industry? Who is being honest that in 30 years, there's almost no chance we'll be producing oil and gas in any meaningful volume? In 20 years, it's quite unlikely. And despite what the industry has claimed around things like blue hydrogen and carbon capture and these other very expensive, impractical technologies, there's just not going to be a market for our oil anyway. The second question to ask is, who's being honest about the challenges of transitioning away from fossil fuels? This is essentially the corollary, because there are candidates, there are parties that are saying, don't worry about it. We're just going to move, everything's going to be green in 10 years and everything's going to be good. And that's not helpful. That's not honest. It's going to be challenging. We know that. But that doesn't mean we can't do it. It doesn't mean we don't have to make this transition. And again, in a way that puts workers and communities first. And that leads me to the third question we should be asking our candidates. Who's engaging with workers? Who's engaging with communities? Who's engaging with these other stakeholders, Indigenous leaders and otherwise, to develop alternative economic models? Who's actually thinking about what the future could look like for communities that have traditionally depended on the fossil fuel industry, instead of just hand waving about how it's going to get better? And then the last question to ask is, who's willing to spend what it takes to make this transition fair and make it productive? It's going to cost a lot of money. It's going to cost a lot of public money, especially federal, but also provincial money, to make sure we have income supports in place, retraining for workers that need it, investment in new green infrastructure and new green jobs and so on. It's going to take a lot of money. It's absolutely worth it. But we can't be shy about what it's going to cost to manage a transition away from one of Canada's historically most productive export industries. So at the end of the day, the just recovery idea and the just transition idea, they're grounded in the same premise that we can move towards a more equal and a more sustainable economy, an economy that works better for everyone without compromising our planet. But we need to have the political will to do that. And an election is exactly the right time to be putting politicians' feet to the fire on this issue.
Perfect. Thank you so much, Hadrian. So just a reminder to everyone, if you have questions for any of our panelists, please type them into the chat box or into the question box at probably on the bottom of your screen, I believe, is where it will be. So you can do that at any time. If it's specific for one panelist, please let us know. Otherwise, we will allow all the panelists to weigh in on the issue. Okay. So if you can type it in, I see a hand, but we're going to do the Q&A box. So, okay. Okay, so while we are, I think there's, so the first question that we're going to do, and I think this will be for Sandra, but I believe that the other panelists will have an opinion on it. So during the pandemic, we witnessed the horrible conditions in long-term care facilities across the country. And I will say in the prairies, the situation that happened in Manitoba, in Winnipeg, was absolutely heartbreaking, including for me personally, knowing people there. So what do you think is needed to address this and to ensure that this doesn't happen again? So I'll go to Sandra and then I'll give the other panelists an opportunity.
Sure, thank you for that question. Actually, Adrian talked about it a lot in terms of not going back to normal. And this is definitely one of those areas where normal was woefully ineffective and actually put tons of people at risk. We during the pandemic, we saw over 14,000, more than 14,000 long-term care and retirement home residents and staff die in the first two waves of the pandemic. That's not counting the third and now the fourth. And more than 80,000 residents and staff were infected. And so what we're looking for is actually for federal leadership. What we want to see is the government implement national long-term care standards that must at minimum be publicly, where long-term care facilities need to be publicly governed and accountable to the public. What we want to see is annual surprise inspections and enforcement standards across the country. We want to see public reporting of these violations in these homes. We want to see any funding that goes into seniors care to be attached to these requirements. We want to see a legislation that will address some of the issues. We want to see minimum staffing hours. We want to see sufficient funding attached to leverage real change. And that means being able to hire more people and being able to recruit. So this is a time where anybody who's seeking your vote should be giving you a plan that will actually impact change and better the lives of seniors that we currently have. Anything else is ageist, it goes against human rights. And we have seen firsthand what a public health emergency can do to the most vulnerable. And like I said, if this is not a time when the government has a political will to really implement change, then it will be all for nothing. All those deaths will be not validated and will just be forgotten, and we will go back to doing what we had been doing, which was completely inept.
Thank you, Sandra. Hadrian, did you have anything to add on that one? No? Larry? Oh, you're on mute.
We have to have that at least once an evening. So one of the things that the Congress is definitely calling for is that we need to take the profit, the P for profit, out of long-term care. And that means that we need to bring long-term care homes into the not-for-profit or into the public model. And that means that, for example, Rivera Homes, which are owned by the Public Service Pension Investment Board. Just think about it, Marianne. I know sooner or later, and I hope it's much later in my case, I will be in a home. And imagine being in a home, in a Rivera home, as a retired federal public servant, because that's what I will be when I finally retire, a federal public servant. But because my pension plan wanted to get me more money, is actually got me in a home where my care depends on the bottom line. And when we have a pandemic or a public health emergency, that my very life might be at risk because decisions are being made, for example, to have workers who have part-time employment or contract employment instead of full-time jobs, 40 hours a week, et cetera, et cetera. We know that part of the problem was all of these workers who were going from home to home to home, who had 3 and even 4 homes to go to in order to get 40 or 50 hours of employment a week at low wages. Why? Because those homes were looking at the bottom line. It makes no sense. It really makes no sense.
Thanks, absolutely, Larry, and you beat me to it. That is an issue that we have been calling upon the Public Service Pension Investment Board for many years to divest themselves of privatized long-term health care. And I think that's something that following the election, we will be able to raise that issue again with new members of Parliament. So we do have a question from Michael. What can workers who have relocated to their homes, what can they expect? And I'm not sure if that's in context of being a PSAC member and a public service worker. So I'll answer that, but maybe just the whole issue of the workforce is going remotely and kind of what are some of the impacts. So I can tell you from PSAC's perspective, It's something that we're watching closely because when the pandemic first hit and everybody, moved to their homes, it was for your immediate health and safety. It was for the employees' health and safety. If it's going to be long term and it's going to become a permanent situation, then the employer is going to have to do better. They have to meet workers' compensation standards in your home. They have to provide you with all of the equipment that you need. You need to be able to secure the information, and they need to compensate you appropriately or ensure that you can claim that on your taxes. From a union perspective, it will be more difficult for us to connect with members who may never ever walk into a workplace, who may never actually physically meet their coworkers. So this is something that, we've seen within the platforms, that everybody wants this. And, I question that. I think there's a lot of folks that did it because they needed to at the time. But I think there's a lot of workers, myself included, who can't wait to get back to the office and really see people. So I'll go to maybe Larry, and then I'll go to Hadrian.
Sure. What we're seeing across the board, not only in the public sector, but we're also seeing it in the private sector. And in the private sector, it's perhaps a bit more concerning. So for those of us who have been around long enough, which is no one on this panel except me, back in the 90s, I remember when the internet was just getting started and people were talking about working from home. And we were really looking forward to it going into the year 2000 and the 21st century. And it was going to be great and wonderful until we fell into the whole question of what you said, Marianne, and those were the standards, that would be enforced in people's homes. Ergonomic workstations, for example. What is the situation at home? People working in their basements, etc. And finally, I think what really just put an end to the whole thing was that insurance companies just put their foot down and said, we're not going to insure people who are working at home unless they have proper workstations, etc., etc. And it's not just proper workstations. It's like the stairs that you go down to had to conform to the building code, hallways, all of that jazz. And it just put a kibosh on it. Now we're in a public pandemic and a situation, so we had no choice. But I think we're going to get back to that. But what we're noticing in the private sector is that companies are seeing an opportunity here to close down entire floors downtown real estate and save money for the bottom line by forcing people to just stay at home and work from home. And we've got to really be careful about employers who are seeing the work from home aspect as something that can reduce their footprints in order to save money and to increase profits. So we got to watch for that, and we've really got to watch for people who are going to want to work at the office, and yet the employer is going to tell them, no, try and work from home as much as possible because we just don't have the space for you anymore because we've closed down a lot of the office space. So in addition to all the other stuff that I mentioned. So it's something that we are not going to go back to what we were before. It's going to be a hybrid model. There will be people working maybe 1-2 days from home, the rest from the office. But it's a huge situation as we come out of the pandemic and into the recovery that we're going to have to wrestle with.
Thanks. Hadrian?
Yeah, well, I think Larry used the right word, which is just we have to be careful. I think for all of us who've had the privilege of being able to work from home during the pandemic, we know that there are some great benefits, and we know the evidence that this has really been helpful for caregivers, disproportionately women who are able to balance childcare, especially. Not that they should have had to do that on their own. On the other hand, we know that there are a lot of costs, especially for young workers. This is something that's been lost, is young workers early in their careers lose out on a lot of mentorship and networking opportunities without being in a physical office. So it's a complicated issue. Legally, it's complicated, as Larry suggested. And we're seeing, we're in kind of a weird experimentation phase where, yeah, there are some employers who are trying to push everyone back as fast as possible. There are some employers who are saying, no, now like we don't have an office anymore, and everything in between. So it's, yeah, I appreciate the question, because I think we're all feeling kind of uncertain about what the new normal is going to be.
Great. Thank you. So I'll just mention there's a comment in the chat that says one of our attendees was informed by a federal government insider that the federal government has a goal of having 70% of their workforce work from home. And thank you. I don't think that is actually any secret. They've been very open about that. We have another great question here. So many people are struggling to find jobs right now. We often hear the promises of politicians about how they're going to bring back jobs, but then they offer no real plan. What would be a good plan that takes into account the climate crisis we are facing? I'll probably go to Hadrian first on this. It's a huge question, but
it is a big question. And it's a very fair question. I think a common frustration is that every politician's like, we're going to make 1 million jobs or whatever. And it's a good goal, but it's also not easy. No government can just flip a switch and create all those jobs, with the caveat that actually with sufficient public investment, you actually can create those jobs. And as like one very concrete example of that is, and we've seen a bit of this already in Alberta, is we have this huge problem of abandoned oil wells that need to be cleaned up. The companies that are responsible for them, who are like legally required to clean them up, are all bankrupt and are never going to do it. So now it's a public problem. We need to hire a bunch of people to do that reclamation work. The government should do that. Basically create institutions that are doing that, hire people to do it. And now you've created a whole bunch of green jobs. We can make sure they're good jobs. And they're also contributing to cleaning up the environment. So that's like a very obvious example. But I think the bigger picture is that if you want to create jobs as a government, you actually have to have job creation policies. Not, for example, like a tax cut, a corporate tax cut, which is theoretically an indirect job creation policy. You're like, hopefully if the company saves money, then maybe they'll hire more people, which doesn't actually happen in practice. You have to do things like, okay, on this infrastructure project, you have to hire a certain percentage of local workers. That's something we can do with community benefits agreements, for example. And that's an actual job creation policy. But a lot of our politicians have been afraid to pursue job creation policies, and instead they pursue what they view as just economic growth policies, whether or not those are actually connected to creating jobs.
Larry, did you want to add anything to that?
Well, Hadrian covered it very well, but what we need to do is make sure that when we have candidates or parties that are talking about creating 1 million jobs, that they're not depending on the markets to do that. The example that Hadrian used was that the government would have to step in and hire all these people to clean up the wells. So the government absolutely needs a strategy. It needs a plan on how to do this. And we know that there are parties, especially on the right, that don't believe in governments doing that job. They believe that we should leave it up to the free markets. We should leave it up to the market, and the market will do that. And we've seen that the market has failed spectacularly in the case, for example, of cleaning up the oil wells or cleaning up the pollution and the toxicity caused by extraction of natural resources. So as we move into the green economy, the government is going to have to put those policies in place and funding to make sure that, you know, people are going to step up to the plate and say, yes, we can do this. But it really is going to take a philosophy where we do need government and we do need the public administration to step up to the plate.
Perfect. Thank you. So I think we've got one more really great question that I suspect everyone may want to weigh in on. So that will be our last question to the panelists. But again, if you have questions, feel free to put it in there. And if we have an email address for you, we will be able to respond to you. So Sandra, this one will go, I'll give you the first chance at this one. Great question. What do you say to people who see that privatization of healthcare? Positive, it'll decrease wait times and increase access. Who believes the picture painted that a tired system will increase access to all? Sandra?
Thank you. That is actually a really great question, and it's one that we get asked all the time. There's a lot of push by privatizers to actually put that narrative out there. The reality is quite a few realities. First, we have a finite amount of frontline staff. And so when you take frontline staff out of the public system into the private system, you create that void in the public system. Secondly, what happens is that when you basically are being driven by profit, like I said before, you're cherry picking, because the only way that you can make a profit is by having that efficiency. So you start looking at the easy cases, and then the public system gets stuck with the harder ones and having to fix the botch cases in the private system. What also happens is that we have no accountability. In Alberta, we have a government who's really high on trying to copy the Saskatchewan surgical initiative to address some of the wait times. The Saskatchewan surgical initiative was successful only when the government was pumping in millions of dollars. And after a couple of years of pumping millions of dollars, they couldn't keep up. And Saskatchewan didn't have a wait time issue prior to them wanting to bring in those private surgical facilities. But now they do, because again, we played that game of taking staff from one place and putting it into the other. Alberta experienced that. We did that. We went there in the 1990s with the Health Resource Center. That place was a private facility. It went bankrupt. We had, as taxpayers, had to come in and put millions of dollars to fix that again. And then it ended up happening that they went bankrupt anyways, and we had to bring in 900 surgeries back into the public system. So we've tried that. Privatization does not help with wait times. That's the biggest myth ever. What we need to do is actually find solutions within the public system. We need to be looking at how it is that we prioritize. How do we make sure that within the public system, physicians are having more access to OR times? And so there's all kinds of solutions that can be actually found within the public system without having to go and give contracts to the private system where there's no accountability. And for people who say that they're fiscally responsible, we never see that. We see the opposite, where there's no accountability as to the money that's being spent. So it's a bit of a nonsensical kind of approach to dealing with a problem that should be dealt with in the public system.
Thanks, Sandra. Hadrian or Larry, did you have anything to add?
Well, Sandra's the expert, but I will just add that this is not just theoretical. Like, as Sandra said, we've had examples in Canada, and there are a lot of examples around the world. There are a lot of public healthcare systems that are being pressured to privatize, and we've seen the outcomes in those countries, and it's not better on wait lists, on outcomes, certainly on the efficiency of the healthcare system in terms of total money spent and then actual health outcomes. So we know it's not a better outcome. I understand why that argument is put forward. It's intuitive. You're like, oh, well, we're just going to add more capacity to the healthcare system. But that's not what happens in practice, as Sandra said.
And be careful when people talk about private investment. It's just another word for privatization. And when people talk about access and universal access, if you've got money, you've got access. So this is where people are playing with words, and we have to really listen to what the candidates are saying. Because they'll say, if we just put more private investment into the system, then we'll have universal access. Of course, then people who have money will have access. Right now, if you've got the money, you can go down to Mount Sinai in New York or wherever in the United States and get access to healthcare. But that's not what we want in this country. We don't want a two-tier system. We want a one-tier system where everyone has access, and the same access, not depending on your pocketbook or your credit card.
Yes. That's a really good point. Marianne, can I just add something, just building on what Larry was talking? One of the other things that we always hear, part of the narrative that we always hear is that, don't worry about it. We're still paying for it. There won't be any cost out of pocket. It's funded by the public system. But that again goes against that nonsensical approach that we could be investing that money into expanding the public system rather than lining the pockets of private corporations that are seeking to profit from the poor health of others. Canada has always seen as a fertile ground for that to happen. And so we have people from the United States, from everywhere in the world, trying to come into this market that has until this point be somewhat protected. And we need to continue to protect our public healthcare system in that manner.
Thank you. And I'm going to throw my 2 cents in on this issue. And in terms of when we look at privatizing and those who say, well, corporations should be able to make a profit, that's their right. I mean, we are in a capitalist, it's economics. But all we have to do is look at the Rivera, and I'll be specific to Manitoba, the Rivera situation in Manitoba, because it became front and center nationally when the staff had to phone 911 because the residents had basically turned acute and they could no longer they could no longer care for them. And I can only imagine the anguish that the staff there. This was not strictly COVID related. The first building that had an outbreak has had cockroaches for years. It's absolutely ludicrous to me. They had no intention of investing into ensuring what, they came on the news and told everybody they were going to do. The CEO came on the news and lied about the situation, like outright lied, and said they were fully staffed. And it wasn't until the union members from the facility came out and said that's a lie. So if we look at that situation and take out the pandemic piece, we know where their priority is. Privatized healthcare, whether it is for surgeries or diagnostics or private, like for anything else, what makes you think it would be anything different? And yeah, sorry, that's my little soapbox. So, okay, well, I think we are getting to the end of the evening. So I do want to thank all of our panelists for agreeing to spend the evening with us. We know that it's really busy and everyone, there's huge demands. And so I want to thank you for being part of this and for your expertise and your knowledge. Just the expert knowledge is something that really helps us be able to take out the anecdotes and get down to the real facts. And so I want to thank you for that. And finally, I do want to remind folks to vote. This election is going to be won on the candidates who are able to get out the vote. Whatever candidate you vote for, when you go to the ballot box, you need to vote. So remind you of that. The advance polls are closed, but you can vote in person on Monday or at any Elections Canada office at any time. And so, let's vote to commit to making a difference for average people like you and me, someone that understands workers' rights and understands that good jobs matter, that funding healthcare and having a vision for pharmacare that matters, and vote for a person that cares for a just recovery. We do have the power. This may be the election where one vote counts more so than any other election, but we have the power to have a government that will support you and your family. And so I would invite you to visit the PSAC website, PSAC Prairies website, and the national website for some election news and campaign platform information. And on that note, thank you, everyone. Take care, remember the fundamentals, and let's all vote on September 20th.
Thank you. Bye-bye.
Thank you so much for the invite.